Heart health, the Indian context, and the unraveling puzzle. Let's talk heart attacks in India. It's no laughing matter, friends. Every minute we lose someone to sudden cardiac death. Globally, heart disease remains the number one killer, with India leading the charts, of course. It's no secret why. It all boils down to reduced blood flow to the heart muscle, courtesy of narrowing or blocked coronary arteries. The ripple effect: chest pain, shortness of breath, heart attacks, and other life altering complications. We've heard it all before, but let's break it down further. The culprits, the risk factors. At the heart of this issue is atherosclerosis, a sneaky buildup of cholesterol, fat, and other substances on arterial walls. Think of it as your coronary arteries becoming a clogged drain, except instead of water, it's your blood struggling to get through. The usual suspects for this plaque party: high blood pressure, high cholesterol, smoking, diabetes, sedentary lifestyles, obesity, unhealthy diets, family history, and yes, of course, even your age and gender. Now the symptoms are pretty textbook: chest tightness, also known as angina, shortness of breath when the heart can't keep up, and the big bad wolf, complete artery blockage leading to a heart attack. Add in nausea and sweating, and you've got yourself a terrifying picture. Diagnosis and treatment. The usual drill is, how do we spot the sneaky disease? With tools like ECGs, stress tests, echocardiograms, and the all-revealing coronary angiograms. Treatments start with lifestyle changes, easier said than done, friends, and move on to meds like antiplatelets, aspirin, clopidogrel, etc., beta blockers, statins, and nitrates. For severe cases, it's all about angioplasty, stents, or a coronary artery bypass graft surgery. And these are heroic interventions, but don't exactly solve the underlying problem. They just reroute the blood flow. But that's not just, friends. That's an amazing feat achieved by the modern medicine. Prevention, where it gets tricky. Conventional wisdom says prevention is the key. Maintain healthy blood pressure, manage cholesterol, eat right, exercise, and avoid smoking and excessive alcohol. All sound advice backed by NICE guidelines, the American Heart Association's directives, and the ICMR's recommendations. These strategies have been effective for about 42 to 49 of the percentage of the patients. But what about the other 51 to 58%? The cracks in conventional wisdom, friends. Here where it gets really interesting. High blood pressure, and now the American Heart Association says keep it below 110/70, but the European Heart Association is happy with 130/90. Cholesterol, we're told LDL is bad and HDL is good, but studies like Malinsky et al. Showed that even low LDL can lead to heart attack. And Abergome, a Danish research institute led by Abergome, demonstrated how high HDL can be risky for some populations: the Northwestern Indians, the Pakistanis, Iranians, the Caucasians. And diabetes, it's a ticking time bomb, friends. But even active, athletic individuals, yes, bodybuilders too, aren't immune to sudden cardiac death. Diet? Saturated fats were long the villain, but a dietary guidelines advisory committee's review of 35 million Americans over 30 years found no clear link between dietary fat and heart disease, friends. Mind blown? You're not alone. The big question: what is a healthy heart lifestyle work wonders for some but not for others? Statins come with their own baggage. Intermittent fasting helps some, while frequent snacking helps others. And physical activity isn't always the magic bullet we think it is. Clearly, there's more to the story than meets the eye. And so it's time to look inwards, friends. As Indians, we're sitting on a treasure trove of ancient wisdom, Ayurveda. Could this be the missing piece? Ayurveda has a legacy of explaining heart disease in its own unique ways, focusing on balancing bodily energies, the Vata, Pitta, and the Kapha. Perhaps it's time to delve deeper into this heritage, integrating it with modern science to address the gaps left by conventional approaches. So the takeaway is heart disease is a complex puzzle, and while modern medicine has made great strides, there are still cracks in the framework. By combining the rigor of modern research with the holistic wisdom of Ayurveda, we might uncover solutions that benefit all patients, not just the lucky half. The journey is long, but the destination, a healthier, more comprehensive approach to heart health, is well worth it.